The special equipment that we have to assess LASIK vision candidates are a special corneal topography unit called an orb scan, which measures the shape and the thickness of the cornea. We also have a separate visual field machine which measures the side vision for the patient. That's automated, and without even dilating the patient, we have a new instrument that gives us a panoramic view of the entire eye called an Optos. And that instrument really allows us to rule out any issues inside the eye when we look at a patient who may or may not be a candidate for LASIK. So by doing an Optos, by doing a corneal topography such as an orb scan, doing pachymetry, we're able to really tell if the patient's a good candidate or not for LASIK. The machine that we use to do LASIK is by Bausch & Lomb, which is a long-standing company in eye care out of Rochester. And Bausch & Lomb makes contacts, and they make implants, and they also make lasers. And the laser we have is called a Technolas Xioptics laser. And it's been upgraded to the newest level of speed, computerized scanning and tracking, so that if a patient starts to move their eye, the tracker actually works to hold their eye in place and follow their eye wherever it goes. So we get very good efficacy. It's also faster, so the speed of the laser shots is much quicker than the standard laser. As compared to a Vizx laser, it's almost twice as fast. And so I've used all the lasers. This laser has an excellent wide optic zone, and of course the custom Xioptics Xi-Wave version of the laser is just one of the best in the industry. So when we perform LASIK, we use an instrument called the Xi-Wave that actually takes like a fingerprint of the eye. And once we do that, it actually is linked to the Xioptics laser. And so we can actually take the fingerprint, put it in the laser, press the patient name, and the laser will have an individualized custom treatment for their eye, which is just not available a few years ago.